My name is Dr. Paul Knoll. I'm a board certified urologist here in Nashville, Tennessee. I'm making a series of videos to talk about certain medical conditions and then see if there's management options for those conditions. So let's get started. Urinary incontinence, aka urinary leakage, occurs immediately after a prostatectomy. This is a stress incontinence, which means that you leak urine with a laugh, cough, sneeze, bend over, those kind of things, etc. 80 to 90% of people restore their continence function within 1 year. But we are able to restore your continence if this doesn't naturally occur. So why does incontinence occur? We'll start off with a normal anatomy. Our bladder is filled with urine and the urine is stored inside the bladder. But what prevents the urine from just leaking straight out of the bladder out the end of the penis is that we have two sphincters or two barriers. As you can see, we have an internal urethral sphincter and an external urethral sphincter. When we do the prostatectomy, you have to remove the prostate's connection from the bladder and from the urethra tube, and then the bladder is then re-sutured back to the urethra. But when we do the prostatectomy, as you can see here, we cut at these yellow lines. And when we cut the yellow lines here at the bladder-prostate junction, you're removing that internal sphincter. And then you can see though that the external urethral sphincter at the bottom is spared. So once the prostatectomy is done, your internal sphincter is gone, but you still have the remaining external sphincter. What does occur after though is that the external sphincter isn't able to keep the urine in because there's only one barrier, but over time, that external sphincter can start taking over the function of both of those sphincters. So how do we manage this incontinence? There are short-term options, there's behavioral things you can do, reduce your fluid intake, there's physical therapy such as pelvic floor therapy or Kegel exercises, and there's also protective barriers such as pads, diapers, catheters, and penile clamps. I call these short-term options just because they don't really fix the problem, they just kind of mask the problem, they can be expensive, and it's frustrating to leak urine, and that's why it ends up being just a short-term option there. But there are long-term options that are available. The male sling is the first one, and that's designed to support the urethra tube to control your urine better. Studies have shown it may be the most appropriate for mild to moderate stress incontinence. And it's made of a soft mesh material that is completely concealed inside the body. The other option is an artificial urinary sphincter. You lost one of those sphincters or barriers, we're putting in an artificial one that can help control the leakage of urine. This is designed to replicate the function of the external sphincter muscle to control that urine. It's just basically giving you an additional barrier. It can treat all levels of stress incontinence, and it's made from 3 small connected components, which I'll show you a video of, and it's also completely concealed inside the body. So first we'll talk about the male sling. This is somebody who has some mild to moderate leakage. Their external sphincter is still intact and it's stopping some of the urine from leaking. This just needs some extra support. As you can see pictured here, this male sling is placed, and what it does is placed underneath the urethra tube and pulled up, and that basically just allows you to have extra support and less chance of leaking urine afterward. The benefit and the risk of the sling, the benefit is that it's a minimally invasive procedure. You can return to normal activities in about 1 to 2 weeks after the procedure. There is no interaction with the device, meaning that you go up to the toilet and urinate like you did in the past. And this can help restore your confidence. What are the risks of the sling is that there can be device failure, meaning that you still have some leakage afterward. That's about a 10% chance of happening. You can have urinary retention, meaning the tension of the sling is too tight and it doesn't allow the urine to come out like it should. You can have some postoperative discomfort and some irritation at the wound site. So I wanted to talk to you about the artificial urinary sphincter. The way that that works is that there's an incision made between the scrotum and the anus and a very small incision made well below the belly button to place the device. The artificial sphincter has 3 components. There is a pressure regulating balloon that just holds a little bit of fluid that goes deep to the pelvic bone. You'll never feel that. Then there is a urethral collar that's wrapped around the actual urethra, the P tube, and closes the urethra off. And then there's a very small pump that's concealed inside the scrotum. You can feel it from the outside, but I could look at you naked and you wouldn't be able to see. What you do when you want to urinate is you push the pump that allows the cuff to open and it allows you to drain your bladder. And then over time, this will automatically close back off, and then it allows you to control the leakage of urine. So let's talk about the benefits and risk of the artificial sphincter. The benefit is that it mimics a healthy sphincter. This allows you to urinate when you desire. It offers most men with a weakened sphincter muscle the ability to achieve continence. And again, it's placed completely inside the body and it is undetectable to others. The risks are that yes, you can have a device malfunction or failure, which may require revision surgery. Usually these last anywhere from 5 to 7 years, and if there's an issue that does occur, men are more than happy to get this device replaced because they were so happy with how dry they had been. It can erode. That collar that we talked about can erode inside the pee channel. You can have urinary retention, where you just have issues being able to pass your urine, and there can be infection, pain, and soreness. But overall, very, very highly successful procedure with low risk. For the sling and the artificial sphincter, the insurance coverage cannot be guaranteed. Overall, Medicare does cover it, and most commercial providers will cover this. You know, our doctor's office will work with the insurance to help with this, but this is something that the sling and the artificial sphincter are great options for you if the short-term options fail, and we will get you taken care of.